Good evening, ladies and gentlemen. My name is Victor from the Star Events team, and I'm glad to be your host for tonight's session. Thank you for joining this Health and Nutrition online seminar on uncovering stroke myths. This 1-hour session is organized by Star Media Group, and a big thanks to the Angel Initiative for supporting and making this webinar possible. It is definitely an honor to have them with us. For tonight's session, we will be joined by our speakers, Dr. Tan Wee Yong, Consultant Neurologist from the Thomson Hospital, Kota Damansara, Dr. Siva Sita Ramya, Consultant Neurologist from the Subang Jaya Medical Center, and the session will be moderated by Dr. Wan Ashraf Wan Zaidi, Clinical Neurologist and Internal Medicine Physician from the University Kebangsaan Malaysia. This session is streamed live on Starbiz Facebook page, so thank you everyone for joining us and tuning in right now. Do share our Starbiz Facebook Live with any of your colleagues, friends, and family who are keen to join. All right, a few quick housekeeping matters before we begin. As everyone dials into this webinar through different internet bandwidth and devices, you may or may not experience minor technical glitches, so please be patient if there's any. To minimize the risk of technical glitch, all participants are muted and video cam turned off by default. But do participate by posting questions to our speakers, and you may send in your questions to our speakers at any time during the session. On your user panel, click on the Q&A button at the bottom of the screen and post your questions there if you are using Zoom. As we are pressed for time, please do not just leave your questions anonymously, but do direct your questions to the panelists so that they can actually answer it to you. For those who are actually joining us on Facebook, you may place your questions on the comment section. However, if you wish the panelists to answer you directly, then please do register and join us on Zoom. There will be a short survey at the end, so to those who are joining us on Zoom, please take a few minutes to complete it as your opinion matters to us. Lastly, and most importantly, please engage, learn, and enjoy. Dr. Ashraf currently works in HUKM, and he joined the Future Leadership Program at the World Stroke Organization in 2020. And he does research in internal medicine and neurology. His current project is related to stroke riskometer, which is used to assess future stroke risk. He is interested in stroke prevention and hyper-accurate stroke reperfusion treatment, multimodal imaging, and endovascular treatment for acute stroke. He did his stroke training at the Comprehensive Stroke Center at the Royal Melbourne Hospital. He is currently the Vice President of MSc and is actively involved in training physicians in stroke reperfusion treatment and thrombectomy. And now, without further ado, I will pass it back to the moderator, Dr. Wan Ashraf, to begin the session. Over to you, Dr. Ashraf.
Hi, thank you, Victor, for the kind introduction. And I think maybe it's not too late to say Happy New Year to everyone. And thank you again to the Star Media Group, Angels Initiative, with collaboration with Malaysia Stroke Council in organizing this webinar today. So today we'll be talking about stroke and uncovering stroke myth. So basically the topic is about stroke. So we do have two speakers as mentioned by Victor just now. And before that, maybe a bit more on the speaker. So the first, or the panelists. So the first panelist is Dr. Siva Sita Ramaya. He's currently working at Subang Jaya Medical Center as a consultant neurologist and physician. Since 2015, he completed his basic degree and also master's in internal medicine in and subsequently joined neurology under Ministry of Health in 2010 and had an attachment same place as mine, Royal Melbourne Hospital. And upon completion, he played a pivotal role in establishing acute stroke service at Hospital Kuala Lumpur. And he was involved maybe the first thrombectomy in Malaysia back in 2014. This is before the endovascular thrombectomy, something like called angiogram of the heart, is being approved in 2015. Okay, and the second panelist is Dr. Tan Wee Yong. He's basically esteemed colleague consultant neurologist from Thomson Hospital, Kota Damansara, and also currently the medical advisor at Region Rehab Hospital. Dr. Tan specialized in the field of stroke and cerebrovascular neurology. He completed his fellowship at the George Institute and Sydney, Australia, and basically has been involved as a key speaker in numerous neurology conferences, and also being a steering committee in advancing stroke care paradigm, especially in Malaysia. He has passion in stroke and has been involved in lots of as a co-researcher and co-investigator in a lot of research and published in top journals. Besides that, I think this is most important that Dr. Tan shared with us today. He's passionate and talented in cooking and baking as well. You maybe can follow him in the social media for that. So before I first start with Dr. Siva, maybe I'll just recap for the participants. Stroke is a medical emergency, and it's basically a problem in the brain. And in particular, this is basically because of the blood vessels issue, whether it's blocked or this is due to narrowing, or maybe it's become very, very small and narrow because of very high blood pressure, or even there's a blood clot because of the heart issues or uncontrolled diabetes. And another issue that can happen in stroke is bleeding stroke. This is because of blood vessel rupture. Therefore, as I mentioned, to treat stroke, we need to be very fast. And the mantra as a stroke neurologist, we always discuss about time is brain. There's a publication in 2014 from our colleague. So we noticed that as low as 29% or 35% only the participants in the research done by the UKM group, Dr. Anwar Din and also Dr. Nick Azlan during back then, acknowledge about the risk, they call the stroke signs. We're going to the stroke signs now, and only about 29% know the stroke risk factor. So Dr. Siva, so I start with you first. What are the usual stroke presentations we need to inform the public, especially our participants today, and common mistake by the public, and according to your experience when they encounter a stroke?
Hi, Ashraf. Thank you so much. Thank you, Star Paper. So I'm actually glad I was given the chance to talk here now. So first of all, as Ashraf has said, stroke is an emergency. Time is brain. So when you have any symptoms of stroke, you have to go to hospital as soon as possible. So how do we identify what are the symptoms of stroke? So in the past, we had an acronym called FAST, F-A-S-T, and used to identify the symptoms of stroke. But recently they've added BE, B fast. So B fast is added somewhere in 2017. So B stands for balancing difficulties. So if a patient has balancing difficulties, either it's a spinning sensation, or they feel they can't walk steadily, their head is spinning, they feel actually nauseated. So all these are signs of stroke at the back of the brain. Number two is eye. E stands for eye. So when your eye's vision is not good, either you're having blurred vision or you can't see one eye, transient loss of vision, either single eye or both eyes, or you still can see, but what we call as actually tunnel vision. That means you see at the center, but at the sides you actually cannot see. Or there is one part of, we call it visual field. That means if you're looking in front, you can't look at the side. So this is what we call visual field affected. So when the visual field affected, the patient sometimes when they walk, they have tendency to hit into things. I mean, they will walk, then they hit the edge of the door, the edge of the table and all that. Next is F. F stands for face. So you realize your face is not symmetrical. There's a bit of droopiness, either eyelids, face, and the entire face. There could be some numbness over the face area as well. A stands for arm. So arm weakness or arm numbness. A simple thing is you can ask the patient to raise up his hand and see whether he could do that or not. So usually the affected side, either right or left, they couldn't lift up the hand. S stands for speech. Speech, there are two components. One is the speech not clear, slurring. Slurring means when they talk, what you call as dysarthria, where the patient can't talk properly. They can't pronounce things properly. So in a simple term, we say they are like really mumbling. But there is another component of speech where they can't talk at all. That means there's another component called dysphagia. Either they can't talk or they can't understand. That means when you ask them something else, they'll answer you something else, or they keep on, talking, and that doesn't make any sense at all. So this is a sign of stroke. And of course, lastly is T. T stands for time. So if any one of your family members have any one of these signs, not all the signs, any of these signs, you have to call. Of course, in our country, we call 999. Of course, in US and all that, they call 911. So here you call 999, or you rush your family members as soon as possible to the nearest hospital that has the stroke facility services. So the common myth is like that some patient would think that, okay, I have only one symptoms and it happens at night. So probably I can sleep first and then I can wait until the next morning, then I can come. But this is a wrong concept. The concept is you have to come as soon as possible. As we know, time is brain. Every second, the brain cells are affected. Every second, the brain cells are dying. Every second, the neurons are dying. So you have to go as soon as possible to a nearest hospital. Imagine if you have a heart attack. Would you wait until the next morning? So for us neurologists, brain is as important as heart, if not, it's more important than heart. I personally believe, I don't know about Dr. Ashraf and Dr. Tan, brain is more important than heart. Not because I'm a neurologist, but brain is very important. So if, sure. So if you have any one of these symptoms, you have to rush to hospitals, because if you come on time, we have treatment for that. If you come as soon as possible.
Yeah, thank you, Dr. Siva.
Welcome.
So yeah, if you notice, Dr. Siva emphasize any of the symptoms. You don't need to fulfill all the symptoms, and it's already too late. And maybe just to add on, another myth that always happen is basically some of the patient mentioned there is no doctor working at night or after hours or in early morning. So doctors working throughout the night, as Siva mentioned just now, as a neurologist and even a physician, brain really, really important and does matter. Then we go fast with the stroke treatment. And just now, very important, I think we need to know this BFAST acronym. Yeah. Okay. So maybe 5 seconds there. 1, 2, 3, 4, 5. And thank you, Dr. Siva. So we move to Dr. Tan. So this is regards to Dr. Tan is around. Tan, are you there?
I hear, but the video has been have to host has disabled it. I think you have to open back my video.
Okay, maybe the host can help Dr. Tan. Yeah, maybe just I'll just continue with the question first. So we have listened just now about the stroke symptom detection, and the one of the things just now, patient basically need to see all the or need to experience all the symptoms and assume some of them go to sleep after detecting the stroke symptoms. But that's quite common now. Public also asking about viral question. Maybe Dr. Tan, you're also aware of this. Should they prick the tips of their finger or part of their earlobes before they come to the stroke they come for the stroke consultation as a life-saving maybe treatment? So maybe you can comment on that and maybe elaborate from your experience at the time.
I think this urban legend has been circulating for many years. So over the years, it popped up intermittently. So when something like the lie has been told many times, some people assume it to be true. So, but I think I agree with Dr. Siva earlier. We should actually recognize the symptom of stroke by the bystander or the patient itself and rush to the nearest hospital or call for help. To answer directly, should they prick tips of finger or part of their earlobe? I say no, and I think most of the experts will agree. But it's still being practiced. But if you still think that it do help you, you can do it, but it doesn't really conquer any help. But the only help that only treatment is to find the nearest hospital and go to the nearest hospital. That is one. So how do they actually find the nearest suitable hospital that can treat the stroke? So our council has worked together with the Angel Initiative as part of a worldwide stroke outreach program to do a website to locate all these stroke specific hospital in we call it My Stroke Hospital web locator. You can type in any search engine, My Stroke Hospital web locator, MYSTROKE hospital web locator, to find out which is the nearest hospital to your geographical location and try to go there as soon as possible. Speaking of going to the nearest hospital, as Dr. Siva has said, it's either you call the 911 or the family or the friend rush you to the hospital. I think Dr. Siva will also have experience of patients driving themselves to the hospital. So in my experience, there is quite a number. So there's only 3 scenarios it can happen. One, if they make it to the hospital. Second, they will stop by halfway and then they realize their symptoms become worsened, they call for help. And with this, the time actually gets more delay. Or thirdly, they will, some unfortunate people, they actually involved in a car accident on top of the stroke because they couldn't control their vehicles. And then on top of the stroke, they have an accident. So which is a very, very unfortunate situation. So my suggestion is to educate everybody about signs and symptoms of stroke. So even a bystander can recognize it and call for the help as needed.
Dr. Siva, do you have any addition to that?
Yeah, I would agree in our sort of culture, especially like certain culture that they believe that when you prick the earlobe, there would be some benefit or they can clear the clot. I don't know how this practice came. Maybe it's very ancient practice. But if you really want to hold on to this practice, whatever it is, I would suggest you rush to hospital. While you on the way to hospital, if you want to prick, of course, it's not advisable, but you really, really want to prick your earlobes, I don't see any harm. But please don't do that. But if your culture says, if your grandma says that, if your mom says that, must do, my suggestion is still you have to go to hospitals. Okay, thanks.
Thank you, Dr. Siva. Thank you, Dr. Tan. So I totally agree. All of us, 3 of us agree that no go actually, if possible. But if you are pressed for the pricking of your tip of your finger, still come to the hospital. And going to the next part is about hyperacute stroke treatment. So maybe I'll just tell the participants and share a bit. So hyperacute stroke treatment from the doctor point of view are within the first 24 hours, the first day of the stroke onset. So, but stroke, as Dr. Siva mentioned before, the first call question is basically need a very fast treatment. You need to recognize it early and you come to the hospital as fast. Remember, be fast. Yeah. So within the first 4.5 hours, the first hour, if possible, you look into our website, the My Stroke Hospital, and even the Malaysia Stroke Council, you need to come within the first hour if possible. Yeah, not to wait until 4.5 hours, not to wait up to 24 hours. This is because of in 1995, called the researcher, the scientist found that there's one called medication called, and it able to open up the blood vessels. And in 2015, as you heard from Dr. Siva biodata just now, so there is an endovascular thrombectomy. So it's basically putting up a catheter or wire, go up to the brain to remove the blood clot if there is, and results in earlier recovery and better outcome. So as any part of the world there's increasing number of stroke, and we see increasing number of stroke ready hospital too. So Dr. Siva, going to you, can you share with us a bit more on hyperacute stroke treatment available in your center, and maybe called from your previous experience back then in Melbourne that arrived within the treatment window, and maybe you can share a bit more on the treatment window.
Sure.
Yeah.
Okay, Ashraf. So in our place we have like a stroke center. So our stroke center runs 24 hours. That means we run at 3 o'clock, 4 o'clock morning, 3 o'clock evening, the whole day. So we have 4 neurologists in our center who works around the clock. Of course, we do calls. We are humans at all. So we have to do calls. So we will take turns. So the patient can come anytime, 2 o'clock, 3 o'clock, we are there. Rest assured, we are there. So same thing throughout Klang Valley or in any part of Malaysia. Most of the hospitals, if you all can check at the My Stroke hospitals, they are detailed which hospitals actually provide 24 hours care. So you can go to the nearest hospital which actually having the comprehensive stroke care, and you will get, the best treatment, either in the government or even in the private. So in our sort of setting, when the patient comes, first thing we ask is when the stroke happened, when the symptoms started. That is the most critical question. So sometimes we need to ask the family members, sometimes we ask the patient itself or any other workers who are there if it happened at workplace. Why is it so critical? Because if you come early, we can do something about it. You have to come as soon as possible. So we can do something, we can give something called clot buster. So ideally how stroke happens is there's a blockage of the blood vessels to the brain. Either it involves the large blood vessels or smaller blood vessels. Either large or small, we have to do CT scans or MRI, to differentiate it. But whatever it is, when you have a stroke, you have to come as soon as possible. The reason is if you come within 3 hours, we still can do something about it. There's a drug called clot buster, which Dr. Ashraf has actually did say earlier on. So we can administer the drug and there is a chance of reversibility. That means your stroke can go away. That means your weakness can improve 100%. Your arm numbness, your weakness, your giddiness, eye problem, all can go away just with one drug. But if you come late, the damage has happened. Once the damage happened, it's difficult to reverse. Although we have the post-stroke care and all that, we don't want to miss the golden period. So the golden period is still within 3 hours. But I say 3 hours, but some patient will say, I still have 3 hours. So I will wait for my son to come back from office. He's now about 3 o'clock, he had a stroke. The son will come back at 5 o'clock. So I still have, because this Dr. Siva said 3 hours, so I'll wait. No, that is not the key message. The key message is, you just imagine you're having a heart attack. If you have heart attack, would you wait 3 hours? No. So same thing like stroke. If you have a stroke, you have to go to the hospital as soon as possible. As soon as possible. Either by ambulance or if any other family members, they will come. So once you reach hospital, what we do is, we do a simple screening method. First, our ER, there's an officer. There will be one doctor in emergency. He will assess you first. So once he assesses, in my place, once it's a stroke, they will call me straight. They won't even do a scan because they want us to be alert. Let's say I'm not in hospital at 3 o'clock morning, I'm at home. So they will alert us, there is a potential stroke case, you have to come. Okay, then by the time I come, they'll do a scan. So first thing we do a plain simple scan. Why we do a plain simple scan? We just want to know, as you know, stroke, there's a form of stroke called infarction, where the blood didn't reach the brain cells. There's another form of stroke called bleeding. So if it's a bleeding, then they call the neurosurgeon. We won't get involved there. But if it's a stroke causing by blockage of the blood vessels, then they will call us. So we will rush there, we will get some history, we will examine you, we will actually check. We have a score, we call NIHSS score. We look at your eyes, we look at your arm strength, at your leg strength, we ask you to walk, and then we will grade it. Once we grade, then we will decide whether we can give the clot buster or not. Okay, all this must happen within 3 hours. For some exception, we do extend for 4.5 hours. we still can give some injection to open up the blood vessels. Anything more than 4.5 hours, it's a bit difficult to give that injection. Then we need to do further imaging, more detailed scan, something called an MRI or CT angiogram or CTP, we call it. We want to look at blood vessels that goes to the brain cells, how much brain cells are viable, how much brain cells that we still can save. Is there any role that we can do anything else further or not? Then it comes to as what Dr. Ashraf said just now, something called EVT, endovascular treatment. Something that we need to call our interventional radiologist, which we have, and we can call him. But even that, we have to do within 6 hours usually. So we have to do as soon as possible. So the main point is here, what we are trying to tell you is time. Everything is about time. Either we give injection for clot busters, or we do intervention, we do angiogram, we open up the blood vessel, it's still time. If we exceed 6 hours, very, very difficult. Still is doable. Now the studies have shown that even after 24 hours, we can do something about it, but that is more a trial sort of like setting, not in a real life in our country yet. So we need more and more detailed imaging for that. We need to establish how much area we can save. And so the key point is time. Another thing is stroke can affect small vessels and big vessels. So in our Asian sort of Asian settings, it's more often smaller blood vessels. Smaller, we call it small vessel disease. Small vessel disease will cause small stroke. So usually clot buster is good enough. There's no role for endovascular treatment. But for large vessels, the bigger one, somehow the injection clot buster, it won't work 100%, probably about 30%, and you may need to go for a bit more detailed imaging and detailed tests, and you may need to go for angiogram and all that. So as far as I know, most of the private hospitals in Klang Valley now offering comprehensive stroke care, including I think this like Dr. Tan's hospital, even in Sunway, even Eshucam, UM. So all the major tertiary hospitals are offering this service. So patients surround Klang Valley, we have to take this opportunity in case stroke happens among your family members. I mean, all the other facilities are there, but we just ask for one thing. Please come as soon as possible. Don't come the next day. Don't come after 3 days. Okay, thank you.
Thank you, Dr. Siva. So basically, again and again, time is brain, need to be very fast. Maybe we should use brain attack too. What do you think?
Yes, yes.
Brain attack. So yeah, so and maybe a common question also after we already mentioned about My Stroke Hospital, then the participants now start to panic. Oh, there's no stroke ready hospital nearby. But still, you need to come to the nearest hospital as possible. If the doctor are trained and they know how to deal with hyperacute stroke, then they will then consult the nearest call hospital that provide the stroke service that we mentioned just now. But even in developed country, only 20% or 30% able to go for the treatment that we mentioned just now from various factors. So maybe not in this webinar, we will then share more in the future. Going to you, Dr. Tan. So can you share common issues? Now we know that we have a patient that can go for endovascular thrombectomy or thrombolysis, and even called immediate usual care, optimal medical care. So by a neurologist or physician that can treat the stroke. But can you share common issues regarding post-stroke care that you have seen and experienced before, and how should they reduce their stroke risk specifically? Obviously, from the publication that I shared initially, it's quite the health literacy in Malaysia is still quite low. And despite having a stroke, sometimes they don't know what are their stroke risks. So maybe you can share on that.
So I think that we have to also, besides time is brain, we have to emphasize to the audience that when a stroke happens, is an active and evolving process. So when the first stroke has struck, so they have to go to the hospital to acutely treat. So if their so-called golden hour has been missed, the stroke is still evolving. So it might turn into a bigger stroke or a more massive stroke. So that's the reason of you still need to get to hospital regardless that you make it within the golden hour or not. One is to arrest the progression of stroke. Second, to find out what exactly triggered the stroke. And third, to find out to treat accordingly and also effectively what is the causes of this stroke. So in Malaysia, the most common causes of stroke is actually hypertension. In 70 to 80% of stroke patients that we've seen, they actually have an underlying hypertension. Whether they know they have a hypertension or they actually do not know they actually have a high BP, because when you have a hypertension, sometimes it's a silent disease. You do not know that you actually have a hypertension unless you have a complication like heart attack, stroke, or kidney failure. That is already too late. Second is diabetes. Malaysia is the obesity rate is increasing. So, but now I see a lot of people getting more active after the MCO has been partially lifted, and then there is a good sign. Third is hyperlipidemia. Fourth is cigarette smoking. So, and also inactivity. And medical condition, one frequently I think missed is atrial fibrillation. Atrial fibrillation is a medical term which I can translate as irregular heartbeat in your heart. So if this irregular heartbeat, it causes a blood clot to form in the heart. And from this small blood clot, it will go all the way, transfer to your brain and cause a stroke. And atrial fibrillation is also a very, very silent disease. It only has very mild symptoms like uneasiness and also sometimes very little palpitation. So all this can be overlooked. So, and also lifestyle factors like smoking, excessive alcohol drinking, unhealthy diet, overweight, and lack of exercise. This is potentially modifiable factors. So once the patient is admitted, I think the neurologist or the physician will look into all these factors and try to tackle this factor accordingly to prevent a second stroke. Because if a second or the third stroke happens, it is usually very devastating and most of the time is fatal. We do not want this to happen. So I think that this is the important factor. That is why we still need to admit the patient even if they feel well for the at least observation for 24 to 48 hours. That's another important thing to look at, I think.
Thank you, Dr. Tan. So basically, I totally agree. Sometimes majority of the patient will we feel that their stroke symptom is very mild, that they didn't arrive to the stroke to the hospital. And both Dr. Siva and Dr. Tan mentioned just now called small stroke. For example, when the small stroke is, the size is still very small, I think that's the best moment, right, Dr. Tan, to prevent the subsequent even more worse stroke. So then I think we need to make everyone here, the participants today, to really knows that we need to prevent the subsequent stroke if one suffers stroke. Yeah. So for everyone information, about 60% patient who suffer a stroke can be dependent. Basically, they require certain support, whether partially or fully dependent with their family members, carer, something like that. So and one of the other common myths that we're discussing about myth today is basically some will say, okay, stroke will take about days to improve, weeks to improve, or after 3 months, maybe, or even 6 months. Then afterwards, there's no hope to recover. Or yeah, some because of some assume because of part of the brain is already dead. So Dr. Siva, can you share with us your opinion on stroke recovery and how a post-stroke survivor and the post-stroke carer will go through after a stroke?
Yes, Dr. Ashraf. So we have something called neuroplasticity. All right. So neuroplasticity means our brain is not fixed. All right. Our brain can regenerate. Modeling can happen. New neurons can regenerate. All right. So it happens a lot in children. So if you see children, their brain is still growing. up to 18 years old, their brain is still growing. But all the other studies have done on post-stroke survivors after brain injuries, that we have found that even adult brain have a lot of role for plasticity. Plasticity means it's like a plastic where you can still, bend, so the brain can still accommodate some changes. It is not once the brain cells die, everything is gone, loss of hope. Maybe about 30 years ago, we don't have this sort of concept. So we say he has a stroke, and end of the care, end of life. Now it's not like that. Now we have extensive rehabilitation. Every stroke center should come with a rehabilitation, and every stroke center in Malaysia, we have rehabilitation. So we have this dedicated physiotherapists, we have dedicated occupational therapists, we have speech therapists. So in acute sort of setting, when the patient is in the ward, after the acute, hyperacute stage, that means the first 2 days has passed, the patient is stable, the blood pressure is okay. Then after the 3rd day onwards, we try to start as early as soon, rehabilitation. First, we start in the ward first. We will try to ambulate. I mean, the patient, we ask them to sit up, slowly to stand, and then we try to walk with the help of our physiotherapists. Then we bring them to gym. Then we introduce various exercise for them. And then there's something called occupational therapies. Occupational therapies is not new. It has been there, but now for past 5-10 years, we have seen a lot of rapid improvement. Now in our center per se, we have like a robotic sort of assisted. So they have the devices that can help them to use their hand. They can fix their device, like Iron Man, they can actually fix something, and then they can play video game with that. And then, so there's a lot of new things are actually coming up, and there's good things now. There's a lot of rehabilitation hospital as well. So I think there's one hospital, rehab Cheras has been doing a good job. Now in private, there's a few other rehab hospital, Daihan. Now there's one in PJ. So there's a lot of rehab hospitals. So during the acute care, the most important is the family members. So what I always tell my nurse is transfer of care, because when the stroke happens, the family members don't know what to do. So they will be looked after by our nurses in the ward. So the transfer of care must happen. So the transfer of care between the nurses to the family members. So I always ask the same question: who will be the main carer? For me, we have to identify the carer. Without the carer, is difficult. So the main carer would be, once the patient discharged, who would be able to look after the patient. So usually usually the first thing, the family, members alone, either the children or the sisters, they can become the main carer. So we will ask them to stay in hospital. Our nurses will teach them. Then we educate them how to do physiotherapy. Some stroke patient needs a tube feeding. So we will ask them how to learn the tube feedings. We encourage them to ambulate as soon as possible, to walk as soon as possible. Most important things, we don't want them to fall. Stroke patient losing the balance. They are not strong. When they walk, they are not steady. So we don't want them to fall. So they already have stroke. When they fall, they are old, their bones are thin, they get osteoporosis, and they can fracture. So we will inform all this. Sometimes what we do, some of our physiotherapists, they do home assessment as well. Home assessment in the sense that how far from their room they have to go to their toilet. If they're on wheelchair, if they're on frame, walking frame, can they walk? Can they go to the toilet or not? Is their house is good? Is their house is accommodative? Are they living in an apartment? Do they have lift? So all this, some home assessment would be done. And then we will help them to assist and all that. And there's something called NASAM. There's a stroke care. So there are a few other centers in Malaysia. So the most famous one is near Asunta. And then there's one in Ampang. And then there are few states. All other states have their own branch. So they have been doing an excellent job in a post-stroke care. In fact, there's one hospital in Malacca as well, also helping out for rehabilitation for the post-stroke care. The most important thing in post-stroke care is the patient himself. About 30% of patients after stroke, they go into depression. I always, as a clinician, our role is whenever patient comes to the clinic, we assess their mood. We see how they are. Sometimes patient won't come and inform us, I feel down, I feel depressed, doctor. All this happened, I was active before, now everything gone, my life is upside down. But as a clinician, we need to identify what are the signs of symptoms of depression. Let's say they have loss of mood, they are not interested to do daily things, they just keep being quiet, they're isolating themselves, they're not going out. So all these are signs of depression. And depression is treatable. If you treat your mind, then the body will be healthy. So these are the keywords which I would like to share here. Thanks.
Thank you, Dr. Siva. So yeah, I think in short, the stroke recovery is actually lifelong, right? So, and as Dr. Siva mentioned just now, is actually patient call themselves need to be really motivated in a good emotional state. We need to recognize that if there is going to depression or a bit traumatized with the stroke, and this is also involving the family network. So it's not just the patient alone. So as compared to heart attack, yeah, this is a bit more because you need to have a very good family network when one suffer a stroke. So I think we have discussed a few of some of the common myths within our community about from stroke symptom detection. So recap a bit just now, stroke response for following the stroke symptoms and treatment available from called hyperacute, so meaning when the acute stroke is there, when it happened, and then how to prevent and stroke recovery. But I think we do have a lot of interesting questions here. Maybe I go to you back, Dr. Tan. So yeah. So basically, one of the early question over here is this. But I'm interested here also at the same time in the chat. My hubby had a slurring and feeling giddy for the past 2 days. Should I take him to hospital? Number one, and when any patient have called the BFAS symptom just now, how you know this is a transient ischemic attack? This must be somebody that are called well versed with medical terms. And what are the symptoms to look out? What's your advice, then, Dr. Tan?
So yeah, I think from the BFAS acronym that we have said just now, giddiness is a symptom of stroke, but might not be necessarily a stroke. So it has to examine by a qualified doctor or clinician to determine this is a sinister sign of stroke, coupled with other physical findings. So on the safer side, I would advise to visit any nearest healthcare facilities to be examined by a qualified doctor. That is one. So and second is second question is what is the second question, Dr. Ashraf?
To determine the transient ischemic attack.
Transient ischemic attack has been defined as a rapidly resolving neurological symptoms which disappear in 24 hours. So, but if you have the capability to go to the nearest hospital, by all means, you still need to go to the hospitals to do a examination, because to have a TIA is actually a warning sign for a full-blown stroke to happen. One. Two is for TIA to happen, that means that your system, especially your brain system, is actually under some stress. I mean, stress means under stress due that it might cause a full-blown stroke, as I said earlier. And if we can treat the underlying causes that cause the TIA, a full-blown stroke can be prevented. And the first 3 weeks of a TIA is actually the most important. And a lot of studies have shown that if we leave that TIA within the 3 weeks, 80 to 90% of full-blown stroke will happen. That is proven by a lot of research worldwide and also in our country.
Yeah, so I think some of the experts basically also want to change the TIA rather than in Bahasa we say that stroke ringan or called warning stroke in English. So some will change it to threatened stroke. So really will come, as Dr. Tan mentioned just now.
It's just a matter of time that when you will come, we will leave it. Yeah.
Yeah. So we, as usual, we do expect this question, Dr. Siva. some of us assume that stroke are called disease of the elderly. Can the young stroke can the young people suffer a stroke?
Okay, it is a misconception. So my youngest patient of stroke I had last year was 18 years old girl. 18 years old girl, she came with a mom, she came with a grandma. So the grandma asked me why my grandchild got stroke. So how do I answer that? So stroke can happen to anybody, depend on the risk factors that we have discussed earlier. Some young people have certain risk factors, especially cardiac risk factors. They may have a small hole in the heart, what we call as PFO. That's called as patent foramen ovale. So they are born with a small hole, but the hole didn't close. So they grow up with a hole. So there's a shunt. That means a blood clot can move that forms in the leg, can go to the other part of the heart from right to left, and that can go to the brain. So usually young people can get stroke like this, or some of them they can get stroke because of underlying problem. So they may have some other problem like SLE, like connective tissue diseases, or some other diseases that can predispose to stroke. And some patient, sorry to say, some sort of substance abuse, especially in young boys, young men, also can cause strokes. So stroke don't only affect elderly people, stroke can affect young people as well. So anytime, young age, old age, you have the symptoms, be fast, consult a doctor. Don't wait, don't assume things. Thank you.
I think we are going to 50 or going to 100 soon for be fast. Must be very fast to come.
So yeah, I think I echo what Dr. Siva said about young people. The other thing that young people is also very physical active. Last year, I treated 2 patients who actually had the dissection of the artery when they do extreme sports. And
maybe you need to tell the participants what is dissection.
So dissection means that your artery actually twists. They will say your blood vessel actually twisted in the neck when they do an extreme sports. This patient actually landed on the neck when they do a back flip. So yeah, for young people who doing all these extreme sports, parkour and all this, which is very, very, very popular now, I think need to be really careful.
Yeah, there's a tear in the internal part of the blood vessels. Then it produces a flap, and that's very scary, right?
Yeah.
So all of us must have seen it, and it happened in young. So basically, that is a myth. So if stroke only happened in the elderly, and I also joke around with my patient because of the WHO announced 65 years old is elderly. So anyone less than that is actually young. So okay, so anyone less than that should be young, yeah. Okay, so as expected, also we do have question on the other supplementary treatment. So the time. So from your experience and maybe from literature, what are your take on traditional Chinese herbs here? There's a question on traditional Chinese herbs. But this one is actually causing a stroke. Can the traditional Chinese herb cause a stroke? And maybe you can also immediately comment on approach with supplementation. Yeah.
So I'm not trained in traditional Chinese medicine, but I do know that some of the traditional Chinese medicine, they do have some content of steroid. Either they are adulterated steroid, or the herb itself is actually a weak steroid by itself. So with this, it will cause elevation of hypertension. And hypertension, as I say, it is a major cause of stroke in most of Malaysians. So from this, I do see those people who do take some herbs to strengthen their body actually unwittingly cause some hypertension. So I think that if we want to take, you can take sparingly and do check your blood pressure very regularly. Not all people is suitable to take herbs. I think so.
Yeah, thank you, Dr. Tan. So I try to call, there's a lot of questions, very interactive participants today. So we discussed about treatment just now, bits of supplement. And so yeah, somebody says, OMG, can children have a stroke? Yes, it can, but it's rare. Okay, so somebody also commented that they're asking about atrial fibrillation just now. We already mentioned. So, but called maybe a bit called re-emphasize again, Dr. Siva. There's still a question on: does all stroke patient need to have physiotherapy? So, and can they function normally even with a small stroke? Yeah.
Okay, so the stroke can affect different parts of the body. So if the stroke mainly affecting the eyes, then physiotherapy of limbs might not be helpful. But if the stroke affecting speech area, of course, we do have speech therapists who can assist on them. Mainly, physiotherapists help for the limb weakness, limb spasticity, limb rigidity, and also for gait training. So these are the main area where we do the physiotherapy. For eye stroke or even for stroke affecting the language area, physiotherapy alone might not help, but speech therapy will help. But long-term recovery, I always tell my patient, don't give up, because we have seen patients improving. The first good recovery will happen very fast, but up to 6 months, you still can recover. So I will always say this to my patient: you can recover. The first month, don't give up. Second month, don't give up. Third month, fourth month, fifth month, sixth month, don't give up, because you still can recover. Whatever you want to do, you do. For the first 6 months, you recover a lot. You recover almost 90%. But after that, you still can recover. So I give hope to my patients that even after 1 year, you still can recover. Not 100%, but probably the additional, 10%, you still can recover. But you have to believe. If you are not strong in your heart, you will never improve. Your heart must be strong. You have to believe yourself. Yes, we will recover, and you recover. Thanks.
Yeah, thank you, Dr. Siva. So think that's a very important advice. Need to really motivated again and again after a stroke and try to recover. I just had a New Year visit by one of my patient with a narrow blood vessels, as Dr. Siva mentioned. So that's very common in our country and this part of the world, Asia. Because of just now Dr. Tan also mentioned about being having diabetes study in Cheras, for example. I'm from UKM, so Cheras, 50% of our stroke patient are diabetic patient. So that patient particularly recently had very narrow blood vessels and big vessels. So almost 2 years ago, he had a very bad stroke. But this week, he able to talk to me. So this is after multiple times of rehabilitation. This is a team network. So our hospital rehab Cheras nearby help us to basically provide the rehabilitation post-stroke. So yes, some of the patient still able to recover, and you need to provide the best rehabilitation service if possible. There's also a question here. Tan, maybe you want to take this question about, does insurance cover stroke treatment?
I think most major insurance cover stroke treatment, and I think that with our effort for the Malaysia Stroke Council, we have actually meet with the major insurance provider in our country, and in fact we have made roadshow and go and speak to the agent and also the company itself. In fact, I myself I went to the headquarters and have a total session with all the industry player, and we emphasize that stroke treatment is actually more economical if we treat at the hyperacute and early phase. So it would be painful if we do not allow stroke treatment to be covered by insurance in the early phase. So if we treat the stroke early enough, patient will recover earlier, and of course your premium your claim will be lower. So it all makes sense to the provider, and most of them do cover acute treatment. And In fact, they even encourage their account holders to be active to prevent stroke in like pushing some apps, some rewards that I think that and also some even go to the claim or no claim bonus, that is to reward those people who keep themselves healthy. So I think yes, major insurance company cover, but of course it depends on your when you buy your insurance and when is your cooling period.
Yeah, so I think that's also related to the next question. Here is about called yeah, it's easy to say about called going to hospital, everything, but cost is still a big issue among some of us called the public. So and basically some cannot call get the treatment. But maybe I'm coming from the call government hospital. In Klang Valley, as Dr. Siva mentioned just now, so I call there's a lots of also nearby hospital that provide the stroke service, even the new one. So the medication that we tell and even the called the procedures. But at the moment, the procedures, the one with the endovascular thrombectomy, we require a bit of payment for that, and it is expensive. That's why prevent the stroke is important. So, but if, for example, you have a stroke, you still can go to the government hospital. I hope that's answer this question. And young stroke, we already answered just now. So maybe we have called a bit more time for the last question. Can we take this hot potato question? Can COVID vaccination, Dr. Siva, cause stroke?
Yes, it has been reported COVID vaccination can cause stroke. Personally, I have seen probably 1, 2, but it is not a stroke that because of blockages of the blood vessel of the arteries. What happened was the patient had he had a vaccine, and they had a blockage of the venous system. So as you know, in our brain, there are two forms of system. One is arterial system, one is venous system. When the heart pumps, the blood goes to the artery, to the brain. The same blood must come back to the heart. So it actually comes back to the venous system. So certain vaccine has been reported worldwide as well. Personally, I've seen 2 cases. But again, we have to understand that we are giving vaccination for millions of people. At least I think more than 95-98% of adult population has already been given. So when you are giving vaccines for millions, so it has been reported like 1 in 1 million or 4 in 1 million. So when you're injecting so many people, yes, it can happen, but don't be alarmed because that's not common. It is like 1 in 4 million. It's like 1 in million. Personally, I've only seen 2, but that 2 is a treatable condition. So the patient came with a headache, and then we did an MRI. Then we realized the venous system was blocked, and we put them on a blood thinner, stronger blood thinner for at least 6 months, and the patient improved. Of course, yes, it actually can cause a stroke, but different form of stroke, what we call a cerebral venous thrombosis. Thanks.
Thank you, Dr. Siva. So maybe Dr. Tan, you want to share also during this pandemic any issues? Basically, hopefully this also increase the confidence. I think high risk patient, especially stroke patient, my stand is still going for vaccination is better, especially for the adults, because of the risk of COVID-19 is even worse.
Yes, yeah. I do agree. Sometimes we do not actually find a direct causative effect. Maybe it's just a coincidence, but they are, like, I agree with Dr. Siva, there might be 1 in 2 might be a direct causative effect.
Yeah. So in fact, maybe I can share also, it's not published yet from our center, but called stroke, basically among, I think Dr. Tan also involved in one of the publication that we gather in Malaysia. So the totals during the pandemic, stroke service was affected because of maybe patient really scared to come to the hospital. So that's also another myth. Stroke still emergency. We still need to come to the emergency department. We still provide the service. And what happened is we follow up on the stroke because we want to know how much stroke patients are actually directly due to COVID. This is active COVID. It's actually a bit more, a lot more than the post-vaccine, and but it's actually significantly lesser compared to the risk factors that Dr. Siva and Dr. Tan have shared. So diabetes, hypertension, high cholesterol, smoking, that is more common, and that kind of patients still keep on coming. So we don't know where they go, Dr. Siva, Dr. Tan, during the COVID pandemic. So we follow up on the COVID-19 stroke patient, the mortality or the risk of death directly due to COVID stroke is basically high. So, and this is more common than just vaccination cause stroke kind of thing. And from my experience, majority of the time, the COVID-related stroke, as Dr. Tan mentioned, some of them may not have a risk factor, but some of them actually have a risk factor but never checked. Yeah, quite a significant number. So maybe I think we are at the last call, few less than 3 minutes, I think. So maybe I go back to Dr. Siva. Maybe any, actually, I'm very honored to become the moderator today to Dr. Siva and Dr. Tan. And this is a New Year webinar for me also. So before we end, maybe Dr. Siva, you have any advice and your hope to the public and the participants today that are joining us, and for in particular in terms of stroke related today.
So I would like to say the key, message is the speed, time. So if you have a stroke, if you have any signs and symptoms of stroke, which we have said earlier on, the be fast, you have to go to hospital as soon as possible. Don't go to, traditional healers, don't go to clinics. We are not saying that clinic, doctors cannot treat you, but don't waste time there, because the best treatment you still can get in good stroke centers, in a big tertiary hospitals. So don't waste the time. The key thing is think of it that you're having a heart attack. If you have a heart attack, what would you do? Would you stay in the house? Would you wait? No, you go to hospital. Same thing, if you have symptoms of stroke, go to hospital as soon as possible. That is the key. If you come late, unfortunately, there's a lot of things we can do if you come early. So my keyword is time is brain. Think of it like as Ashraf said just now, brain attack. Heart attack is brain attack. It's as important. For me, brain is more important than heart.
Totally agree.
Okay.
Thank you, Dr. Siva. So very nice one. So brain attack, brain is more important. Okay, Dr. Tan, so maybe your advice to all your followers.
Okay. I think thank you for the webinar to reach out to the masses. And I think as I would say, time is brain. And if you in doubt, go to our website, My Stroke Hospital Locator, to locate the hospital and come to our hospital, any hospital nearest to the geographical location as soon as possible. With that, I thank you, and everybody have a good night, and see you all next time. Bye.
Thank you, Dr. Tan, for very sweet summary, and on behalf of the Malaysia Stroke Council. Thank you to the Star Media Group, Victor's here, Angels Initiative for organizing this webinar today. I myself learned a lot today with a discussion with 2 expert panels. So, and I hope then in the future we can meet up when the things are a bit more controlled, and we have less concern about Omicron and the new Micron. So, and with that, I think thank you and see you again next time. And I pass back to Victor. Thank you, everyone. Good night.
Thank you, Dr. Ashraf. Thank you to our expert panelists, Dr. Tan, as well as Dr. Siva, and not forgetting Dr. Ashraf as well for moderating this session. It was indeed a fruitful session, and I believe that the audience actually learned a lot from each panelist and have some very valuable takeaways, especially those who are suffering from stroke or are taking care of someone diagnosed with stroke. I'm sure that our audience has a better understanding of stroke and the treatment options available now. as we are dispelling any of the myths. Before we end, please help us complete the evaluation poll, which will appear on your screen now. And once again, thank you everyone for joining us today, and a big thank you to Angel Initiative for supporting and making this webinar possible. For those who like to rewatch tonight's webinar, it will be available on our StarBiz Facebook page. Good night, take care, and do stay safe.